Tactile agnosia, or astereonosis, is the inability to identify objects through tactile, thermal, and proprioceptive functions, even though these functions may still be intact. Lesions in the brain, such as occur during stroke, can interfere with the mental association of meaning with perceptions. Stereonosis deficits are thought to originate from disturbed integration of information from the somatosensory system. Tactile agnosia can occur with or without the presence of other conditions. To determine the specific diagnosis, evaluation can be performed using tests that assess which deficits are occurring. For the stereonosis test, inform the client, I'm going to put a form like one of these in your hand so that you can feel it for a little while. Then I'll show you all the forms and you can show me which one was in your hand. Block the client's vision by having them close their eyes or using a buffering item in between, and make sure they do not get other cues from the object, such as smell or sound. Common items used for this test would be balls, spoons, pencils, keys, rings, pennies, or buttons. Test each hand separately one at a time. Bilateral manipulation of the form is not allowed. Scoring for this test is non-standardized. Stereonosis is determined to be intact if the client can correctly identify all the objects within a reasonable time frame. Note that the normal time is 5 seconds of contact. Make sure to record all the time required of the client to identify the object. Validity for this test can be improved by ruling out other tactile recognition and neurological deficits. The second test is the Ayer's manual form perception. The procedure is identical to that in the stereonosis evaluation, but the materials are standardized. The item kit contains 10 plastic geometric forms that must be identified from a selection of printed forms placed in front of the client. The assessment is used for children ages 4 to 8, but can also be used for adults if the scoring is non-standardized. Otherwise, scoring for this assessment is standardized. Stereonosis is determined to be intact if the client can identify correctly all the objects within a reasonable time frame. Validity for this test can be improved by ruling out neurological deficits and paresis of the hand. The third test is the morphonosis test. This procedure is also the same as the stereonosis test, except that the objects used are required to be made of stiff paper rather than three-dimensional shapes. Scoring for this test is non-standardized, and validity can be improved by ruling out paresis and impaired sensation of the hand. Morphonosis is determined to be intact if the client can correctly identify all objects within a reasonable time frame. The fourth test is the ahylonosis test. This procedure again is the same as the stereonosis test, but this variation requires the use of objects with different textures. For example, cloth, silk, sandpaper. Scoring is non-standardized. Ahylonosis is determined to be intact if the client can correctly identify all objects within a reasonable time frame. Validity for this test can be improved by ruling out impaired tactile sensation and paresis at the hand. Let's take a look at an evaluation of stereonosis. Hello Kirk, my name is Josh. I'm going to be your occupational therapist today. Do you know what occupational therapists do?
No, I don't know.
We help you apply your skills to activities of daily living following some kind of injury or in an effort to rehabilitate you.
Okay.
You've suffered a cerebral vascular accident or stroke, which may be affecting your ability to identify objects using your sense of touch. So I want to perform an assessment to evaluate whether or not you have tactile agnosia.
Okay.
Okay? So this assessment is designed to see whether you can use your sense of touch to identify objects and whether or not there might be some kind of stereonosis deficit.
Okay.
Okay? So what I'm going to have you do is close your eyes. I'm going to put an object in one of your hands, let you feel it for a little while, and then I'm going to take it from you, and then I want you to open your eyes and see if you can identify which object you have. Okay?
That sounds reasonable.
Alright, so if you'll hold out your right hand and close your eyes for me, I'm going to place an object in your hand. I want you to feel it around for a little while, okay? Make sure you keep it in your hand the whole time and only use your right hand. Okay? Alright, feel it around for a little while. Okay, open your hand please. I'm going to take it from you. And keep your eyes closed. And now open your eyes and please tell me which object you are holding in your hand. That's correct. Thank you. Okay, we're going to repeat this test to evaluate the left hand as well, okay? If you close your eyes for me, please, and hold out your left hand. I'm going to place an object in your left hand. I want you to feel it for a little while. Make sure to keep it in your hand the whole time. Okay, you can feel it around for a little while. Keep your eyes closed. Okay, I'm going to take it from you now. Please open your eyes and tell me which object you were holding. That's incorrect. Note that the client was able to correctly identify the object within a reasonable time frame for the right hand, but was unable to do so with the left hand. Stereognosis would only be deemed intact for the right hand. There are two approaches to treating tactile agnosia, restorative and adaptive. The restorative approach posits that the brain can recover sensory function over time through reorganization and neuroplasticity. By providing appropriate stimulation to the finger receptors, tactile sensation can be improved. In stage 1, a stimulus like Velcro is moved along the fingertips until the client is able to appreciate the stimulus. In stage 2, the client progresses to appreciation of stationary tactile inputs required for holding tasks. Hi Kirk, we're going to administer an intervention designed to improve your appreciation of the sense of touch. Okay? If you could close your eyes for me and hold out your left hand. Okay? I'm going to rub a fabric up and down your fingers, and I want you to tell me as soon as you can identify what it is.
Velcro?
Good. Excellent. That's stage 1 of this approach. In stage 2, we're going to progress to another object for you to identify. If you could close your eyes and hold out your left hand for me. Go ahead and feel this object. And is it hard or is it smooth? Is it rough or is it smooth?
It's both.
Okay, and is it heavy or is it light?
It's light.
Okay. Can you identify what the object is with your eyes closed?
A coin.
It's a coin. Okay, very good. Thank you. I'm going to take it from you. Using the adaptive approach, educate the client about their condition, emphasize sensory tasks of interest to the client at the beginning and end of each treatment session, explore stereotypical motions that engage other senses and unaffected extremities, for example, lateral motions to identify texture, pressure to identify the hardness or static contact to identify temperature. Train the client to focus on specific object properties that can be identified, such as texture or weight, and to use objects within normal contexts. Presenting objects of personal significance to the client can facilitate object recognition by engaging associated perceptual processes in the brain. Evidence for these approaches is limited, but adaptive strategy training has been demonstrated to be an effective intervention for achieving independence in occupations for patients with tactile agnosia. Hi Kirk, we're going to try another intervention today using the adaptive approach to treatment for tactile agnosia. What I'd like you to do is I'd like you to close your eyes and we're going to try to button your shirt all the way up, okay?
Okay.
All right, I want you to use both hands and let's try it.
Okay.
Good job. We can open your eyes now. All right. Now, I want you to take the pen here in your left hand, okay? And I want you to try to write your name.
With my eyes open?
With your eyes open. Okay. Good job. Hi, Kirk. We're going to try another intervention using the adaptive approach for treatment of tactile agnosia.
we're going to do an exercise to train ourselves to use both hands to identify an object's properties. Okay? One of these water bottles has been in the freezer. I want you to use both hands to tell me which one has been in the freezer, which is the cold one.
Both hands? At the same time?
Yes. That's correct. Good job. Okay. Now, this next exercise is going to teach us to use visual cues to identify the temperature of an object. Okay. One of these objects has been heated on the stove. We can tell because it's red. Okay. So, tell me which one has been heated without touching. That's correct.